There are 3 different types of giving sets for fluids. A normal giving set which can be adjusted for speed using the rollable clamp. There are giving sets specific for a giving pump. These are for delivering fluids at a precise rate. Finally, there is a giving set with a wider lumen, commonly for dispensing blood products. This will contain a filter. It can also be used for giving more viscous products, such as colloids. Priming a line and setting up a fluid pump will be demonstrated. Open your giving set and your bag of fluids. Remove the top of the fluids and insert the sharp end of the giving set firmly into the fluid. Before you do this, ensure the rollable clamp is shut and depress the chamber as you insert it. This will reduce the number of bubbles in your line as you prime it. The chamber has a line visible and fluid should be in the chamber up to or above that line. Slowly open the rollable clamp so that fluid starts to fill the line. If you prime the line too quickly, there is a greater risk of bubbles. This specific giving set has a silicone part, which will go through the pump, and this gets squeezed by the pump to control the rate of fluid delivery. Try to prime this part of the line upwards, as the silicone can preferentially cause air bubbles to adhere to it. Then prime the rest of the line as normal. Make sure the fluid goes right to the end of the line and that there are no air bubbles within the line. When you come to attach the line to the patient's cannula, first clean the connector with a sterile swab, then simply screw the 2 connectors together. The rollable clamp can be used to vary the speed of fluid delivery. However, for the most precise fluid delivery, a fluid pump should be used. Fluid pumps vary in design, but the basic principles are always the same. The rate of fluid delivery is set with the total amount of fluid that you are giving. After turning the pump on, you need to load the giving set. Open the door to the giving set and place the blue part of the line with the blue connector, and the same with the orange part. This contains the silicone section of the line. Then close the door. Set the volume to be infused and then set the infusion rate. For example, for this 500 ml bag of normal saline to be given over 2 hours, we would require an infusion rate of 250 ml per hour. The rate lock can be set to stop any changes to this infusion. The pump will alarm if your rollable clamp is closed, so open the clamp and restart the fluids. There may be times when fluids need to be administered as quickly as possible, usually in the acutely unwell patient. For this purpose, we use a pressure bag. It has a sleeve to hold the fluids and can be pumped up to squeeze the fluids as fast as possible. Normally colloids are given with a pressure bag. The fluids are thread through the mesh and the loop is passed through the loop onto the fluid bag and hung on the drip stand. The hand pump has a 3-way tap, and make sure it is set correctly before pumping up the pressure bag. You will notice that it has a pressure gauge. As the fluids are delivered, you will need to add air to the bag to ensure the pressure is maintained. Having discussed the basic principles of fluid infusions, we now see one being given within the clinical setting. Put on an apron and a pair of non-sterile gloves. Make sure your trolley is clean. Open your saline flush and draw up using a needle and syringe. Check that the saline is within use state. Dispose of your sharp. First of all, check the fluids are correct to the prescription and in date. Also check the allergy status of your patient. Open the fluids and close the rollable clamp. Depress the chamber to expel any air and fill accordingly. Slowly release the roller ball and prime your line. Once the line is primed, close the roller ball clamp and check that there are no air bubbles. Hang your fluids on the drip stand. Clean the patient's port with an alcohol wipe and flush with saline to check that the cannula is still patent. Connect the IV line to the port with a twisting action. Open up the clamp. Finally, use the rollerball clamp to set the rate of infusion. All fluids need to be properly prescribed, including run time and volume to be infused. Once given, the chart needs to be signed, including when the fluids were started and when they were stopped.